Welcome. I'm John McGuire, founder and director of the Kinesiology Institute. And thank you so much for coming today to learn more about applied kinesiology. And if you're asking questions, if you're new to applied kinesiology techniques and give you an understanding of how you could benefit, how you can apply it to a practice if you're a practitioner, as well as how you can benefit personally. Give you a little bit of my background, and then we're going to be demonstrating on someone who has some shoulder issues. I'm also going to be telling you other techniques from our various courses. And at the end, I'm going to be giving away a $300 coupon, basically, or discount to any of our programs. So you want to make sure to stick around for that. We'll be going an hour to perhaps an hour and a half. As long as you have questions and I can give you more information, I'm here to do so. So first, a little about my background. First, as a child, I had so many health challenges. They were so bad that I couldn't walk more than a mile without being in pain. So when I was in high school, my doctor gave an excuse saying Johnny is so messed up that he can't attend gym classes. So, I wasn't being able to be a jock, even though I love sports. So good thing is I picked up a guitar and then later became a professional musician. Well, with all my aches and pains, life was a challenge until I got into a natural foods co-op when I was away at Oberlin College because it was the cheapest place on campus to live. So I had back pain, headaches, gastrointestinal symptoms. In fact, when I was a child, my stomach aches were so bad, my mom took me to this doctor and he ran all the tests. And he said, there's nothing wrong with Johnny. In fact, it's all in his head. But I knew my gut hurt, so I had no relief. Well, finally, I get into college, and it was it's the most expensive college in the Midwest. So I wanted to save some money, and there was this natural foods co-op, which I had no idea what it was because I was eating pizza and drinking beer for my staples. So I go to this natural foods co-op, and I found out they don't eat meat. It's all natural foods. What are natural foods? Well, it's basically plant-based diet. And after eating that, all my symptoms started clearing up, including my anxiety, my depression. Then I went off and took a transcendental meditation course. And my roommate was going off to a yoga class. I said, yoga? What's that? He said, oh, join me. So I go to this yoga class. So I start doing yoga, meditating, and eating natural foods. Now you're probably thinking, okay, well, this is like hippiedom, right? Well, it turned out all my symptoms started clearing up. And I then realized what I wanted to do was help other people in suffering learn how they could help themselves with proper eating, living, and thinking. So I majored in psychobiology and then later went to another school where it was a university without walls that I majored in holistic health. Part of my holistic health degree was to become a licensed massage therapist. So I was teaching yoga in Akron, Ohio, along with being a licensed therapist. And one of my students came to my yoga class who was a chiropractor. And at the end of class, he said, here, John, I want to show you something. Put your arm out and hold against my pressure. So he gives me a muscle test, pushes on my arm, and it's strong. He says, watch this. He does something to my energy field, and immediately I go totally weak. And I go, wow, what's that? And he says, well, it's this program called Applied Kinesiology that shows how you can access the energy systems and the human biocomputer, or in other words, the innate intelligence in your body through muscle testing. And you can find out what is going on in all these systems, these energy systems, as well as the structure of the body, the organs, your nutritional state, your mental emotional state. So fascinated by this, I went to a demonstration at his office. And I said, where did you learn all this? And they said, well, from the founder, George Goodhart, doctor of chiropractic in Detroit, Michigan. He made these original discoveries in 1964 that when a muscle is test weak, you can immediately strengthen it by doing various energy reflexes on the body. It's a tremendous breakthrough. So being a massage therapist, I thought, I could probably help my patients with this as well. So I knew I wanted to study this and no courses were available. But finally, in 1981, a course came to my town called Touch for Health. Show you the book here, Touch for Health. This is the updated version from Dr. John Thie. Now, Touch for Health is basically a paraprofessional or a lay approach, a simplified version of applied kinesiology. So I knew, boy, this is really great. I started studying this and using it in my practice, but I wanted to go further. Well, great opportunity came when I started working at a chiropractic office in Youngstown, Ohio, different chiropractor, doing body work. And one of the doctors was going off to study with George Goodhart in his certification, year-long certification program in applied kinesiology. I thought, wow, this is exactly the opportunity I wanted to have to study with the master. So after going through that whole year-long program, at the end, I became certified as a Touch for Health instructor. So from there, I was being able to do the best of Touch for Health, which are more simplified versions of techniques, and then all of the body and knowledge of Dr. Goodhart in applied kinesiology in their basic 100-hour year-long certification program. And putting the two together, I was getting exponential results with my massage clients. In fact, I'd have people coming in from far away, and I developed a practice not only Ohio, but also I saw clients in Pennsylvania and in Florida. So at the end of that year-long certification program and then getting my training as a Touch for Health instructor, I started teaching all over. And in 1984, I was awarded as 1984, the Touch for Health instructor that taught more students than anywhere in the United States. So the Touch for Health Foundation and John Thie, they decided they wanted me to come to Pasadena. So I loaded up my RX-7 and I moved to Pasadena. And then in Pasadena, I became the program director of Touch for Health and started teaching around the United States, Canada, and then I brought Touch for Health to Russia and taught the first instructor training there. I taught the first instructor training in Italy. So I just had such a great wealth of experience from all these people I was able to study with, including Dr. Sheldon Deal, who is a master of applied kinesiology. And what he does that's great is he does all these shortcuts. In a moment, I'm going to have you do some techniques with me. So now that you have a little of my background, I'll give you one more step. From the Touch for Health, I believe it was 1987 where I moved to Pasadena. And then in 1991, I decided, these techniques are all great from Touch for Health, but they're great from Goodhart. And I want to blend them all into a program that's even more powerful for particularly people that are not licensed doctors, because in AK, you have to be a licensed doctor with a license to diagnose to be able to do the AK trainings at that time. So then I brought the best of what I had from AK and put them into this program as my certification program, which has now evolved over the years. I'll talk a little bit about that later in the program. So then in 1994, I had the great honor and privilege of joining Tony Robbins' Life Mastery faculty. And I just 2 weekends ago presented at their big event online. We had 3,000 students online, and I presented from his studios in West Palm Beach. So I'll be giving you some of the techniques today that I did in that presentation. So you're probably wondering, well, let me see something that I can benefit from. So for you that have been in my programs, one that we love to do to begin our broadcasts is the ear unrolling technique. So first, turn your head from right to left and see if there's any tension anywhere. And then we're going to do a very simple technique called the ear unrolling technique. Now, the ears act as antennae for the acupuncture meridians. So take your thumbs and finger and pull on the ear to widen it and unroll the ear. So it's very simple like that. So you're going up, pulling away like this. Just do that several times. Now, what this is doing then is it's bringing more chi or acupuncture meridian energy into your body. Chi is like the life force that runs the body. And there's a quote from Albert Einstein that I love, and it's that, first of all, everything is energy. And he says, the field of energy is the sole governing agent of matter. In other words, this field of energy and all these systems where energy flows through the body in these channels called acupuncture meridians, we have chakras, we have these figure-8 energy flows, things that we cover more in depth in our energy kinesiology certification program. And he said that's what runs the body. So when you activate various energy circuits, it helps the body be at peak performance. So along with helping stiff necks, this is also a great energizer. So whenever you're feeling low energy, like yesterday, I was feeling a little slump in energy. So I took some deep breaths, which I want you to do as well. Activate the energy flow through the breath. And then after unrolling my ears, oh, I had a perk in energy. So let's see if you have any better range of motion now. Okay. Oh, wow, I'm getting a lot better on the right and the left. Great, so hopefully you had that experience too. So remember this technique. The air unrolling technique also has a benefit of helping you to retain information better through whatever you've heard. So it's a great thing to do whenever you're like at a lecture like you're doing now. Or let's say for you that has someone's explaining to something to you, like for you that has a spouse and he's not listening well, say, honey, unroll your ears. I'm trying to tell you something. And you actually can process the auditory information better. So now let's do another one I love. It's called the Thymus Thump. I do this to start my meditations every day. And you might remember from Tarzan, you're thumping on right around where your second button is on your shirt. So you just thump, thump, thump. You can either pound it like this or with your hand. Breathe deeply. And that also is a stress buster. Helps to activate energy flow in your body. So one of the great things about applied kinesiology is so many of the things you can also do on yourself. I have in my Applied Kinesiology Fundamentals program, which right now there's a $200 discount. We'll show you that link later. We have 4 classes on self-help that you can do, including how to do self-testing for muscle testing, how to find out when meridians are out of balance, also how to test foods for yourself, which I love to do. So thumping the thymus again, keep doing that. Now there's another set of points called the kidney 27. What I'd like you to do is take one hand on your umbilicus, on the belly button, and just touch that. This is an acupressure point known as conception vessel 8. And in polarity, they show how all these energy fields come right out of there. So it's like a grounding. It's like your home base. Now, the other hand, you're going to find right under the collarbone, just off the breastbone, this clavicular sternal junction. You're going to rub that. Now, Goodhart called these the switchboard operators of the body. So while you're rubbing that, you can also move your eyes from right to left. These are also points that help the eye muscles, called neurolymphatic points. So it's both an acupressure point and a neurolymphatic point. Now, we're going to get more into neurolymphatic points through the broadcast. And keep moving with your eyes. You can go up and down. And so neurolymphatic points are basically energy switches that help the muscles as well as specific organs have more lymph flow to them. The lymph system is your body's sewer system. So it helps you to detox. Okay, so these points, the kidney 27s, the benefit of those is one, there's a thing called neurological switching. Do you ever have this happen where you get confused, or particularly if you meant to say left and you said right, or you cross things, you got letters mixed up, right to left? That's called left-right switching. And it's basically when you're not able to think clearly and you get mind overload, this helps to sort it out so that it also helps the energy system to get to the proper place and communicate better. So it's the internal like switchboard of the body saying, let's get our meridians flowing in the right direction. So that's another tip for you. Okay, one other one we're going to do is we're going to do a figure 8. Now this is for the eyes. What you're going to do is put, say, your right hand in front and watch the thumbnail and watch go up on the midline and then around in a circle, keeping your head straight, not moving the head, and just keep following that with your eyes. Now, this is particularly good for brain integration. Okay, and we're going to do the other hand now to integrate the right and left hemispheres of the brain. And what we find is that people with learning problems, particularly when you can't process visually, they have difficulty crossing the midline. And that's the bottom line of learning difficulties. And we'll do both hands now, is you got to use your whole brain. If you're using your whole brain, you can remember things well, you can access things well. So this is a great one for visual. So we have a whole program, there's a program called Brain Gym. It's educational kinesiology by Dr. Dennison. And a lot of what we teach in our programs too helps teachers with their students, like classroom. So under stress, we tend to shut down one half of our brain. So last thing we'll do, and then we'll get more into demonstration, touch the frontal eminences. These are the bumps. If you feel on your forehead, go on your eyebrow, and then there's these little ridges and bumps. You want to touch those lightly. And this is another thing to help brain integration, because when we're under stress, we don't think whole brain. So these are very good to do. In fact, I do this more than any other technique. I will lie down, say when I'm going to sleep, and on my side, I'll put my fingers right there as I fall asleep. Now, what these do is it stimulates blood flow to the brain and more oxygen. So again, take a deep breath. And along with that, it helps bring more cortical activity to the frontal lobes of the brain, frontal cortex, and takes it out of the back of the brain where our stress and, let's say, neuroassociations, negative neuroassociations are. So we'll probably demonstrate a little more of that later. We cover that also in our beginning courses, like our Applied Kinesiology Fundamentals, a whole protocol on clearing emotional stress. It's phenomenal, the results of it. So know that we give you really simple techniques and then show you how to put it together. Now, one of the benefits of applied kinesiology is it tells you what to do when, which I'll demonstrate in a moment when I bring Lance up here. It also helps you find what are the priorities. My teacher, Dr. Sheldon Deal, said that 80% of what you find on someone when you're doing muscle testing and that is a compensation, and 20% is the priority. If you fix compensations, either they won't last or you can't fix it in the first place. But when you do a priority, which means it's more at the source of the problem, then sometimes compensations will clear up. And that's the key here. We are not looking to treat symptoms. We're looking to find the source of the problem and clear the source. And we look at the person systemically, the whole body. See, like when I studied massage therapy, another thing that they would teach is, if you got a tightness or pain, rub that and rub the area that's in pain. Well, sometimes that's actually contraindicated. And I found in all the courses I'd study, and I'd study every course that came along in my massage training, and I felt like I was throwing my toolbox at people. So I'd say, let me try this tool. Oh, that didn't work. Let me try another. And some tools would work sometimes it wouldn't, but I didn't know what to do when. So I'm going to show you how I determine what to do when to get a result. And also, you're looking at the whole person rather than I'm just working on one area. I got to think the whole person, and not only whole person in terms of the whole body, but also in their energy field, in their emotional field, in their mental field, and even in a higher spiritual field. So it's a multi-dimensional basis. So Goodhart would talk about a triangle of health. The base of that triangle is structure, the physical body. Then there's another side, which is the biochemical, their diet, nutrition, and even environmental factors. And then there's the mental and emotional. Every side affects every other side. So some cases, a person would come in with back pain and I'd find out, the source of their back pain was emotional issues. And so we clear emotional stress, maybe never even work on their back, and the back pain goes away. Another one I worked at, particularly at the end of while a Robbins program was going on, she had severe back pain, so she couldn't even sit in the room. So she came to me and I found out she had an Ilioceical valve dysfunction, which we cover in many of our courses like structural, the Applied Kinesiology Fundamentals, and our biochemical course. So I fixed her Ilioceical valve, never touched her back, and bam, her severe back pain totally went away. I saw her at the end of the program 10 days later, and she said, yeah, never came back. So when you find the source and correct the source, the symptoms clear up. A metaphor you can think of is if there's a hole in the roof and you got a puddle on the floor and you think, well, I just got to mop the floor. And it came back. Well, I got to get a better mop. It came back. Well, let me just keep trying all these different mops until whatever mop, finally the floor will stay dry. No, you got to say, oh, the source is from the ceiling. So that's what we do in applied kinesiology. So any questions coming up before we get Lance up here?
Yeah, so we did have a couple questions come up. Nothing too related to the demonstration or anything. So I don't know if you want to take some of them now, take some of them later. The only one we had that was kind of related was a question about lymphatic flow.
Okay, we'll take a question about lymphatic flow now. And that is?
So this question came from YouTube, and this was, wish you were here in Minnesota to help me with my lymphedema. I'm at a loss. I've tried everything to clear my lymph system, detox, greens, infrared rebounding, massage fasting, probiotics. Said you had started kind of talking about it a little bit, was looking for some guidance.
Okay, there's a question about a woman who has lymphatic issues, and I believe she's in Minnesota. So if you email me at support@Kinesiology Institute, we have practitioners in Minnesota we can direct you to help you. But there's lymphatic switches on the body, and they're often what really helps. And they're in the Touch for Health book. If you get the Touch for Health book here, I'll show you the chart. We cover these in our classes as well. I think it's around page 55. And so these are, let's see, we've got here. Let me get my glasses on. But you want to basically, there's another thing that might be helpful is rebounding, where you get on a mini trampoline and you can even just put your feet on it. And here we go. It is page 51, okay? Page 51 in the Touch for Health book. This is also in all of our courses that we have the lymphatic switches. So, yeah, I know you've tried a lot of things. You mentioned that you've tried a lot of things. So I would say going to a practitioner. And just to note, this doesn't replace medical, say, conventional Western medicine. It's a first aid, and it's also good to get all of the tests done. I do regular tests for blood work, for other gastrointestinal things, and get all the proper screenings. And there's things that sometimes don't show up in those screenings called subclinical. And it shows up in the energy fields. In fact, your energy field will have to be out for a long time before it will show up in labs. So that's why this is an often great step for you. Okay, so let's bring Lance up here and see what we find. Lance, how are you doing today?
I'm doing fine, thank you.
Great. And you got any gigs coming up?
Yes, this weekend. I have one gig coming up in the marina.
Okay. And you mentioned you have some shoulder issues?
Yes. It's there's an ache in the joint, particularly at night. Sometimes it keeps me up.
Okay. So an ache in the joint. Okay. So what I can do first is just doing a little postural assessment. I'm seeing that this right shoulder is lower than the left. And I'm looking at your alignment of your head and neck. Okay. So there could be some tightness in this upper trap. And is it tighter on the left?
Yes.
Okay. Yeah. So what we do in our courses, we teach you how to do a postural analysis, because the posture itself will tell you things. Now let's face me, and I'm also seeing a little bit of discrepancy. I'm going to check your rotator cuff muscles here, and then I'll check the hip as well. Okay, that's pretty well aligned. Turn around, let me see how the back looks here. Dr. Goodhart used to say, if you listen to a person long enough and watch and see their posture, they'll tell you what's wrong with them and how to fix it. Okay, so now I'm noticing on the back here, there's a little scoliosis. Have you ever noticed that? Like,
no, but I wouldn't doubt it.
Yeah, wouldn't doubt it. Okay. Your mother didn't say, Lance, you have scoliosis. I love your mom. She's great. Okay. Now he's got more tightness here on the sacrospinalis. And so we're going to check some things there. In fact, let's do this. Feet a little further than shoulder width apart. And we're going to do a standing muscle test. I'm going to have you roll this way and head back like this. So lean back. I'm going to pull this back and push this forward. Okay. And hold as I do so. And see that move? Okay, now let's do the other side. Head back this way and don't let me push. Okay, so right away we know there's a weakness in the sacrospinalis muscle. See, so we're looking at the whole posture here. I'm going to show how you can find out if it's a priority. There's a mode. We cover hand modes and finger modes in our classes. And I'm holding this mode and I'm going to pull this again and see if that strengthens it. Yes, it does. So that's going to be a priority. Well, let's just start and balance that. Now there's what I worked with John Thie. He would do the Neurolymphatics. Again, these are switches on the body. So I'm rubbing these here. I want you to get just off of your belly button and rub right 1 inch out from it. And let's get this muscle started. Again, if you have any questions, let me know as we go on here. And then I remember John Thie always loved, he tested this on everybody. And what I had the honor and privilege of is to be his chiropractic assistant, where I would work on people and do muscle balancing. And then afterwards, he would do additional tests and chiropractic adjustments. So I got to see what he would do. And he tested this muscle on everyone. Now, what I'm doing is called Meridian Trace. Again, it's one of the techniques in our courses where you go from beginning to end of the meridian. And it's all the way down to the feet there. And now I'm going to do this. I'm going to do a little light touch here on the head. These are the neurovascular points. They're light touch points. It's the same point I told you earlier. This happens to also connect to the sacrospinalis muscle. Okay, now let's have you bring this back and hold us. Now we're just without any modes. Hold. Much better. Okay, there's another mode we call the more mode to see if we need to do more. And I'm testing that, and it's strong. Okay. Now, the shoulders are more level. Let's see what happens now when you lie on your back. And just so I know, what would you say the pain level was when you walked in, or tension?
About a 7.
About a 7. And how would you describe the pain?
An ache.
An ache, and it gets more worse at night.
Yeah, and it creates a weakness or it's a limitation on my range of motion.
Okay, limit on your range of motion. Now, do you notice after you're drumming that it's worse?
No.
Not really? Okay. So there's a couple other things I like to do. In our courses, we teach this thing called the emergency mode. The emergency mode tells you if the body's in a challenge in either nutrition, structure, emotion, or energy fields. So how we do that is I find a strong indicator muscle here. Let's do the quadriceps. Bend the knee, and it's like this. I'm going to push down and hold. Okay. Now, just to know, muscle testing is not a strength test. It's feeling with gradually increasing pressure if the muscle can hold its position or if it ends up going and moving. So now I'm going to have you go into various hand positions or arm positions. So you're going to go like this, kind of like jet airplane wings. Okay. Now I'm going to check this again and hold as I push, and bingo, it goes. Now that is a sign of nutritional imbalance. The primary ones, and we cover this in our biochemical course, which, by the way, we are about to do our last biochemical certification program. If you've not gotten in on it, we have 2 spaces left. So we'll talk about that a little later. But that is where we go into diet addition. Hold as I push. Ooh, it goes strong. Diet deletion. It didn't go strong. I'm looking for what makes it go strong. And now supplement addition. Okay, supplement addition. So I can ask vitamins. Yes, supplements. Minerals. No. Herbs. Yes. Okay, then we could check if there's amino acids. No. More fiber in the diet. Yes. Okay. So maybe some of the, call them prebiotic fibers. Okay. And then let's check if there's more essential fatty acids. Yes. So I'm getting a good idea of things that could possibly help the shoulder, but also help anything else going on in his body. Okay. So bring the arms back down. And now put your hands straight out so you're like a cross, bringing that like, a plus sign. Let's go here now. Check again and see what happens. And it's strong. So it's saying in a state of like his body really needing to balance something, it's saying more the diet, not so much the structure. It could have been also that. And now let's bring the arms back down, both arms down, and now bring them out so it's up at that same angle. There you go, like a swan dive. Okay, now let's check again. Bring the knee up and hold, and that's strong. That would have been if there's any emotional or electrical or energy field work, such as chakras, auric fields, bring that down, or major emotional stress. So you can bring your arms back down now. That's great. So now we know we're going to look at the shoulder, but we're also going to look at the whole body. Remember, and Goodhart used to say this: anything can cause anything, and anything can fix anything. So this is what makes it so much better in applied kinesiology. You're finding, well, what's at the source? Because again, as a massage therapist, I don't know, I just rub the shoulder and hopefully you get better. Which I learned all these massage techniques, and sometimes it helps, sometimes not. So let's now look at the rotator cuff muscles. So I'm going to be the first one, most commonly injured rotator cuff muscle. And again, we cover this, both our applied kinesiology fundamentals. We also cover it in our structural certification program and in each of our biochemical as well as our sports kinesiology. So you get this one in most courses. Okay, I'm going to push in like this and you hold out. Okay, ready and hold. And that's going weak. Now I can find out if it's a priority to fix it. If I go this way and it goes strong, and it does. Now, by the way, you can have more than one priorities. It just means if a muscle is weak and you touch here, that's the thumb crease in that middle joint here, and the pad of the middle finger. These modes were developed by Dr. Beardall, who observed when he was working with the patient, he had one response, and then he went back, a note in the chart, and went back and he had a different response. And he said, well, what was different? And the guy had his finger where he was touching his thumb to a finger, and then he discerned, oh, there's something that the yoga mudras talk about. I know when I was teaching yoga, there's all these different hand positions for accessing different levels of consciousness, as well as neurology. There's the homunculus drawing that is showing that much of the brain in the sensory motor signals are in the hand. So much of the brain is devoted to the hand. So these hand modes or finger modes are what we use to access what we need. Now I'll show you here. If I touch the thumb to the index finger, that will, if it strengthens a weak muscle, it says we need to do structural corrections. So where the emergency mode that I first did is the whole body systemically overall, now we're checking specifically, how's this muscle respond? So I'm going in and I'm touching thumb to the index finger, and if it goes strong, it says we need to do structural. And it says, in fact, we do. Okay, now I've got this one here, which is nutrition, the middle finger to the pad of the thumb. Hold. Doesn't help. This is emotional stress. See if that clears. Doesn't help. And this would be electrical. And the electrical. So that would be like the meridians. So now what I'm going to do is I'm going to do some corrections based on structure. Now the structure can be the neurolymphatics, which everyone do this on yourself. It's often tender on people. It's right inside the shoulder. And I associate it with whenever I'm doing my income taxes, which is something you've been doing lately. Maybe it's blame the government on this. He was doing his income tax this past week, right? So when you're crunching numbers, it stresses the brain. Now this muscle relates to the brain. And we'll take a question here in just a moment. So when the muscle is weak, sometimes there's stress in the organ that it's associated with. And in our Touch for Health charts, we also have the folio here. There's a page that shows every muscle that relates to what organ it relates to. So are these points tender at all?
No, but just tight.
Okay, so let me get now here on the point in the back here of the neck. How are these points?
A little tender.
A little tender. And how does it feel? Is there
Feels good.
like
It's a good.
yeah, sometimes you'll feel like a release, like, oh God, that's releasing blockage. See, the greater the tenderness, the greater the extent of the blockage. So if you find any points particularly tender on yourself, and rub these now, it's the top of your neck, everyone, do this on yourself. And this is also a great point for headaches. Like I rarely ever have headaches, but last week I was having a headache on the right side, and right-sided headaches are often related to gallbladder and liver. So this is also around what's called gallbladder 20 in acupuncture. And so I did that for 30 seconds, boom, headache went away. Okay, so that was the neurolymphatics. Now I'm also going to work the origin insertion. And what was the question we had here?
So it was from Georgia on Facebook, and it's, hello, I didn't know the emergency mode. Why didn't you use the mudra, M-U-D-R-A, to check if the physical, if it was physical, emotional, or nutritional?
Okay, the question was, why didn't I use the hand modes? And I'm not quite clear if the question was instead of the emergency mode, but let me just explain a little bit, and then you can let me know if it answers your question. So I'm working the insertion point here of the muscle. And those are often, especially with an athlete or like Lance, he's an amazing drummer. And, you know, there's times where you're going all over those drums. I was seeing you soloing in that Kenny G concert you were performing at. And I go, man, he's like a gymnast, you know, like going out there, but doing it for 90 minutes. Like, so it's extreme athletic performance you have to do when you do a drumming in a show, in a concert, right?
Mm-hmm.
Yep.
Yep.
And so this, I'm now working on the insertion or the origin of the muscle in the interspinous fossa. So about the question of the emergency mode versus hand modes. The emergency mode shows the whole body systemically, not necessarily related to any point, where the hand modes are specifically for what you just tested. And I'll show that on other things here. We'll go through that. So in other words, when I was checking the supraspinatus muscle, it wanted structural work and energy work. Now I'm going to go the meridian. I'm going from beginning to end. So that is the energy work. But it said it didn't need nutrition or it didn't need emotional work. So, but other things will need that perhaps. So it's whenever you're checking an individual thing, here's the protocol. You find something out, then you find, is it a priority? If it is, then go ahead and fix it. And then you can look, is there structural work, nutritional, emotional, or electrical? And let's see how that muscle is doing now. So here is the muscle again. It's holding. There's a more mode we show in our courses that shows it stays strong. So that means we don't need to do any more. If it did go weak, then it says we need to do more of either the same or something else, which we explain further in those programs. Now, back to the rotator cuff muscles. Another muscle is the teres minor. Bend the elbow, and I'm going to push in here. And that one's fine. And now let's go to the infraspinatus. I'm going to pull down, and that one's fine. And then we're going to check the subscapularis, which is an internal rotator. Again, we cover all these muscles more in depth in the courses, and hold as I pull up. And that's going weak. So is it a priority? Hold. Yes. Structure? Yes. Oh, now nutrition shows up on this one. And emotional doesn't, hold, and electrical doesn't. So see, it's different on this one. Now this is also related to the heart. So let's just see if, I'm going to check a couple things. I'm going to point right in at the heart and focus, see if it's switching off. Okay, it is. So now again, I can go structure, nutrition. Yeah. So now I can look, before I balance the structure to make the muscle strong or the heart strong, I'm going to find nutrition related to it. In our folio, This is our Touch for Health folio. And again, we cover everything in Touch for Health, but we go beyond that as well. So if we go over here, there's a page for the heart meridian, and it shows the muscle itself. And you were mentioning, I think, too, you had some problems in the scapular area, right?
Yeah, right above or outside of the armpit.
Yeah.
In this zone.
Okay, so that's right where the muscles are coming through. And then you've got perhaps tightness. This is in the teres major. So we'll do some work on that too. So now let's back to the nutrition. Right up here, it says the nutrition for heart. And it's the B vitamins, particularly B1, B2, and then vitamin E and calcium. But also, we're going to look, because nutrition came up in supplements, we're going to look more further at other vitamins. So another one that's really helpful for heart is CoQ10. So let's grab a few of these supplements here. Let's see, we got CoQ10. We got some vitamin E. Let's see if we have, B vitamins here. Okay, so what I can do, and this is another interesting thing in kinesiology, is you can put the person in circuit. So what we do is I'm going to have you bring your feet together, and then when the arm goes down, I'm going to have you move it 18 inches apart. Okay, so hold, and now separate your feet 18 inches apart. Good. Now keeping the feet there, without touching, it remembers we're checking and assessing what's going on in the heart. So I'm seeing, okay, yeah. So we're showing some stress in the heart. Now, you've had checkups recently, right?
Yes.
That shows your heart's okay, right?
Yes.
So again, we don't replace checkups in that, because I worked with Lance and they said, yeah, we want to make sure everything's good. So he's good on that. So here's now the B vitamins. Let's see if the body likes that. Hold. Oh, and it does. And then here's vitamin E. So with it on his belly, there's a field. Remember, Einstein taught us there's energy. Everything in matter has an energy field, and the field is going into his energy field. See if it likes vitamin E. Oh, and it does. Very good for the heart. So we got B, E. Let's check our CoQ10. And okay, there's 3. That's going to really help the heart. Now, let's check. There's one other one I want to check here. Let's see. I think I've got calcium around. And oh, there's salmon oil here too. So let's check calcium. Calcium is very good for the heart, and see if it likes that. Hold. It does. And how about salmon oil? Now, the good thing about salmon oil, it's omega-3 fatty acid. It's also an anti-inflammatory. So your shoulder pain is showing inflammation. All right. So those are the key things there. And I know you've already made some changes in your diet as well, right? Haven't you?
Yes.
Yeah. So now just check. Now that these are strong, if it goes weak, it's a priority. Hold as I push, and it does. So that's one priority. Okay, let's check this now. And okay, this strong. Okay, now it's not changing. So in other words, sometimes people say, wow, 16 supplements came strong. Well, if you wanted to say, you could still take those, but at least take the ones that are priorities. Again, change. Don't think of it going weak. It changed. So hold. Okay, so the CoQ10, let's get you on some of that today. We had CoQ10, salmon oil, not the calcium. Let's check the vitamin E, and that's showing good. Vitamin E is great for a lot of things. It helps put oxygen in the muscles. And then the B vitamins here, they're strong, but not a priority. So of the 3 that were particularly a priority, we've got CoQ10, vitamin E, and the salmon oil. Okay, so just to bring your feet back together now. And if we put these on the body, does that strengthen the subscapularis? Really bend the elbow. So like that, I'm pulling up, and it does. Okay, now another thing I can do, I often do this, is check the joint itself. You know, touch the joint, hold as I push. Okay, it's going weak. Now I want you to bring your chin up to your chest. Just lift the head up and hold that. And oh, that makes it strong. So technique we show in our Applied Kinesiology Fundamentals, as well as our structural course, is called the injury recall technique. And that's a great one to do as well. So now we're going to do that, and that will help the shoulder. And it basically is, have you had, well, even just strains from all the drumming you're doing, it can have a memory that's going to from the brain to the muscle that is basically blocking energy flow when there's an injury. So I'm going to have you touch with your left hand, just touch the shoulder, especially anywhere that it's tender. And then I'm going to bring this up and just relax. I'm just going to bring the neck up and back. And a question that came up.
Yes. So Kim asks, how could you support someone who just had rotator cuff surgery?
Okay, so her question was, how can you support someone who just had rotator cuff surgery? Well, you can take the strong arm and touch various reflexes. Keep touching there. And so I'm doing a correction here. I'm pulling the talus out of the ankle joint, and then I'm going to tap temporal tapping, and I'll demonstrate that in a moment. You don't necessarily, especially if a muscle's been injured where it's too stressful to. In fact, you could do what we're doing right now for the rotator cuff, where the person would touch that, and then it's a little more complicated, but again, in our courses, we do that. So now it takes the hand away. So I'm going to touch this again, and wow, now just doing that correction alone strengthened it. So let's have you arch your head back this time, and it stays strong, okay? So let's get back to the muscle. We already figured out the nutrition for the subscapularis that relates to the heart. So I'm rubbing now the Neurolymphatics for that. And to answer Kim's question, you could touch the reflexes for the muscles. So you would touch, like, say, the supraspinatus reflexes. Then you would touch, say, Teres Minor and Subscapularis and see how he goes weak there, because we haven't really done it yet. Then you would actually, with, say, the strong arm, if it was rotator cuff surgery on the right arm, you'd test the left arm for an indicator. See, just to understand, it's a biofeed, every muscle test is a biofeedback indicator. And if it's strong, it's when I touch a point and it goes weak, it says there's stress there. That can be an acupressure point. It can be a neurolymphatic point. It could be the organ when I'm pointing in at it. So what you're doing then is you are finding where stress is in the body and then relieving it. And I know I had a patient last week who came in and she had some knee problems, and we balanced her knee, but we were working on the whole body and we're clearing all kinds of things out. And then she said when she got back home, her boyfriend says, wow, you look different. Like you got this radiant energy about you. And that's the thing. We are working on the whole energy body, not just the physical body. And when you balance the structure in the physical body, you're also balancing the energy body, because they're basically interfaced. And you have greater energy as well as your emotions. You just feel better, just uplifted. So we got these different systems. Okay, let's, I got another question there, and we're going to work a little more on the muscle from here.
Yes.
Just relax the arm. I'm going to get in here and
So
let me know if I can.
Juanita had a question. I think it was just about what you were doing with the injury recall technique.
Mm-hmm.
So why would you put your head back?
Okay, so Juanita wants clarification on the injury recall technique. Why would you put your head back? Okay, so just a little more about the technique. Is this tender in here, by the way, Lance?
No, it's a little more outside of the.
Like in here?
Yeah.
Okay, I'm going to get on that now. So you just relax. I'm just going to palpate while I'm going through here. Now, in the injury recall technique, if an area tests strong, again, we teach this more in our courses, structural and applied kinesiology fundamentals. You have a person arch their head back if the area tests, and it should remain strong. But if it goes weak, it's saying you need to do the injury recall technique. Now, if an area is weak, then you have the person do forward, which is the correction of the injury recall technique. And if while their head's forward, it then goes strong, then you do the injury recall technique. So why I had him move his head back after we cleared it was to make sure when the muscle's testing strong, that it remains strong when he's in the neck and extension. And Dr. Wally Schmidt, he was one of the doctors I studied with Goodhart. He took from what he learned from a podiatrist about this technique, where the podiatrist just did the ankle correction. And Wally, it was when people have an injury, they cringe, like, oh, and their ankle, their foot will draw up into their ankle and their neck goes back. So what you're doing is it's affecting, particularly from the cerebellum, where this memory is retained as the person touches the whatever the injury area was, or it could be an area under stress, doesn't have to be an injury, and it clears it. So there's an energy phenomena that it gets like erased, and it no longer stores the memory of the injury in the brain. And so there's more energy flow and it allows it to heal. We've had amazing corrections that people have had where nothing else helped, and they had the injury recall technique and said, God, it was like a miracle. So it's one of the first things we often do with people. Okay, so let's check the arm again. Let's see how that's working. Bend the elbow here. I'm pulling up. That's now strong for that muscle. Great. And let's check a few others here. Let's bring your shoulder up. Now we're off the rotator cuff. It's going to bring the head over here, and I'm going to push away as you hold. Don't let me push. And you see that going? That's the upper trapezius. Okay. Now that muscle has the neurolymphatic right here. So I'm just going to go ahead and do it. We could have checked the priority mode and all that, but let's just go ahead and do it. Is this area tender at all?
No.
Okay.
Just a little tight.
Little tight. Okay. Well, tightness counts too. As we say in kinesiology, tight muscles matter. Okay. So let's see.
You know, all in there is in trouble.
Yeah, in trouble. Okay. Let's loosen that up. Now I can also get the point back here on the neck. That's the back neurolymphatics. That's the upper trapezius. It's related to the eyes and the ears. Well, so we've had people some people will have organ problems clear up where I don't even know they have the problem, but I'm working on something related to the organ system. And they go, wow, that helped I had one woman said she had chronic diarrhea, and I was working on the fascia lata related to the large intestine. And she had a car accident, and it was getting her better from the accident. She said, wow, my back's feeling so much better. My hips are, recovered from the accident, but also my chronic diarrhea cleared up. I said, oh, I didn't know you had that. And it was related to, again, the fact I was clearing the reflexes for I'm going to do a little neurovascular here as well. And it was clearing those reflexes helped her diarrhea. So I said, how long have you had that? And she's, God, it's been going on for 40 years. Whew. Wow. So sometimes you can have what seems like miracles happening, because even if you don't know all what's going on with somebody, you just balance the body and things clear up often naturally. Now, just to remember, there are times where there might be signs. So I get people to have full checkups because there could be, I've had cases where someone had a pain and it didn't go away. So I had them check it out. And, there was a tumor or something they needed to have removed. So you want to be aware that this clears things up, and it's great to keep yourself healthy. So with my clients, I say you want to have regular sessions. Don't wait till Humpty Dumpty falls apart and try and put you back together again. Get tuned up. And that's where all these techniques I'm showing you can do on yourself. So when I'm showing a point on Lance, rub it on yourself. And if it's tender, the greater tenderness, the greater the extent of the blockage. Now, often when you're going to test this muscle again, bring the shoulder up like that and the head over to it, back of the ear, hold, much better, okay? So you can do these points like 2-3 times a day, 20 to 60 seconds, and that will help. So let's assess how our shoulder's doing here before we go on. And then we'll check some more of the nutrition we saw earlier, like diet addition. We did see some of those foods. You needed more, I think it was alkaline foods, like more of your, well, we'll check. I know you had fibrous foods, so fibrous kind of vegetables would be good. But in the meantime, move the shoulder around and see if we made any progress.
Oh, definitely. I can already tell just by laying here.
Oh, okay. And you said we were at a 7. What's the pain level, if any, now?
3.
So, okay. So now let's check, because it came up nutrition. So in other words, there are times where I've seen people having a lot of physical issues, and we just changed the diet, including myself. I had a frozen shoulder once, and I went on an alkalizing cleanse, and I couldn't lift my arm up over this, height. And by the 3rd day, I was doing this with no pain, only from checking and changing my nutrition, alkalizing. So what fibrous vegetables would you eat? Like say celery, your plant-based garden kind of variety of fibers.
There's no limit.
Okay.
Yeah.
Okay. So we got that. Yeah. Beets. Yeah. Root vegetables. Let's just check. Root vegetables would be good. Okay. We're asking yes, no. Okay. Give me a yes. Body, give me a no. Okay. So root vegetables. Great. So you got your carrots, your beets, collard greens, kale. All right. And there's a point in our biochemical we show how to test for foods that would be, you didn't have any show up, but let's just double check in case there's some. You can touch right back on the transverse process of C1 and let me know foods you eat that you might maybe aren't eating. Let's just try eggs. Think about eggs. Okay. Hold as I push, and he goes weak on eggs. We kind of found that out in an earlier session, remember? And have you kind of stopped eating the eggs?
Yeah.
Yeah. So what other foods may not be your ideal that you think?
Well, I like granola. So.
Okay, well, let's check. Granola. Okay, granola is not so good. Okay. Do you eat wheat? Breads?
Yeah.
Okay, so think about breads. These are ones that often come up. Let's just see. Breads? Okay, and that's testing weak. Now, let's check his small intestine, because it's often one of the keys for people's health. It's so common we have small intestine challenges. So again, I got a strong muscle. I'm pointing in here and see what happens. Okay, he goes weak. Now, everyone, I'm going to show you the neurolymphatics for this so you can rub them while I'm working on them. They're right on the bottom of the rib line. So if you get on yourself and you push up right along this, like the wishbone, and you're going to be pushing up like this. Now, but on him, what I'm going to do, because it came up herbs, so I'm going to go here and I'll just say an herb just by a side. Okay, let me ask, we've got another formula here with various herbs. It is GI Resolve. It's helping to clean like leaky gut. So I'm going to just put it on his body here, and ooh, he likes that. So often, this phenomena in the gut where we get what's called small intestine bacterial overgrowth and parasites, candida, heavy metals. We don't have time to go into all this now, but these are all in our biochemical certification program. And by the way, if you want to get in that program, you can go on kinesiologyinstitute.com and go down on the homepage, and you'll see biochemical kinesiology. If you click on that, we still have 2 spaces left, and it's the last time we're going to be doing this program in this format. So it's your chance to get in. We're starting with the online. You can either do it online as well as hands-on in Long Beach, but we have a lot of people from around the world that are doing it online. So how we do that is we go on Zoom, and then we teach you how to do remote sessions, which is cool as well. All right. And if you have any questions, by the way, if you want to go schedule an inquiry session with me or my staff, there's also a button. Can you put this on, Thomas, to how to get, and we'll put a link out there for setting up an appointment where for 20 minutes we can answer all your questions and show you on a Zoom session or call on the phone and show you how the course is set up and what you'd get on the website. So now with this small intestine factor, another thing that's common is Ileocecal valve, which can cause right shoulder problems. So let's see if this is an issue. Hold as I push. Okay, now I'm pointing in at the Ileocecal valve. I show this in the Tony Robbins program as well. And I'm pulling up like this and see if it goes strong, and it does. So I'm going to have you hold like this and bring that up there. Now, one of the things that can cause Ileocecal valve is hard to chew up foods, like even including granola. So you may want to have steamed vegetables right now. Your roughage, because too much roughage can actually irritate this valve. It's the valve between the small and large intestine. Again, we cover that in several of our programs. And that alone, if you just keep people's ileocecal valves corrected and in balance, makes a huge difference. Any other questions coming up that would be relevant right now?
Nothing at the moment for this current demonstration. There's two that are related to an actual demonstration, and then a couple others you can just answer when you're done with the demonstration.
Okay. And I want to remind you, we're going to have our drawing for a $300 discount on any of our programs before we end today, as long as you're online. Okay, now what I'm doing now is another neurolymphatic point here for the Ileocecal valve. Now, Lance, if you notice any shoulder, pain, like especially at night, I want you to work these points. You can work right, with your hand. You can kind of take this hand and get right in here and just rub with the part of the palm here, called the thenar eminence, going from your wrist to your thumb, and you just rub that. Everyone can try that on yourself. And by the way, as you're watching, point in halfway between the umbilicus and the hip bone here. You could point in and then pull up towards the left shoulder and see if that makes you feel better. Any symptom gets worse if your ileocecal valve is stuck open or stuck closed. Don't have time to explain the whole thing now, but just know this is a factor that really helps a lot of people. Now, things that cause that, again, can be like diet, irritants. So that's one thing you can rub. And then also, if you notice the shoulder acting up, go up like this and see if that helps. And those would be a couple things. But that's great. We got a lot of result with your shoulder. So let's see. But I'm so thrilled you joined me today. And again, if you want to, and you haven't joined us yet, we have $200 off on our Applied Kinesiology Fundamentals course. You get 16 continuing education credits from the NCB TMB for you that are massage therapists. You know what that is. And it also is our prerequisite for our advanced courses. And if you've already taken our fundamentals course, you can then get in on the biochemical course. We're also starting on the energy kinesiology course in the beginning of the year, where you get certified in that. And I'm here to be your guide. I've been doing this for literally 40 years, and it's so thrilling to hear the results of my graduates and the amazing things that they're doing in their practice, helping people tremendously where nobody else has been able to help them. So I'm here to be your guide and speed up the process, because I've taken 40 years of work and I've distilled it, what you can learn in 2 years of what I learned in 40 years. Okay, another question coming up here, and then we're going to let you.
Yeah, so someone from the live asked, could you repeat the correction for the ileocecal valve? It's kind of confusing live.
Yeah, well, that's why I say the question is, can I repeat the correction for the ileocecal valve? Again, we cover that more in depth in our courses, but I'll give you the Cliff Notes version. If I push in here or touch here and it goes weak, now hold as I push. See, he's strong now, but if it went weak, then what I would do is I would close the valve by pushing up. The valve is like this trap door that's going between the small intestine into the cecum. It's from the ileum part of the small intestine to the cecum. That's why they call it ileocecal valve. So if I'm shutting the door And by the way, you'll have a replay of this too. And now it goes strong. I know that's the correction. So the way I do that is have them or I shut it this way. Now, if that goes weak, then I pull down and out, which isn't as common. That means the valve's closed and I got to open it up. And if that goes strong, then the correction will be pulling down. So the neurolymphatics for this are particularly the shoulder. There's also the inside of the hip bone. You can add that as well. And then right on the head of the shoulder, right there, and you can take your thumb there and then rub on C3, the third cervical vertebra on the side. And those would be corrections for it. There's other corrections we cover and we show in the classes how to determine what foods there are irritating it. That's bottom line, the correction. Hopefully that was helpful. Okay, and let's see how you're feeling here. Let's check this again. So that seemed to help that. And we know there's another herbal supplement we'll get you on. So let's go back to this now. And there's so much more I show in our classes, but for now, we've worked with them for, 45 minutes here, and we've done a lot. And the best thing is, hold as I push down, see if this is strong now. Okay, so we've cleared that mode. So now, stand up and see how you're feeling here. Tell me. I know you said your shoulder's much improved, which is why you came here. Goodhart used to say, that's what you come here for.
Yes.
So how's that feel now?
Much better.
Yeah?
Yep.
Great. And you're gigging when this weekend?
Saturday.
Where at?
The warehouse.
Oh, great. Here in Marina Del Rey. Mm-hmm. All right. Yeah, I'll be by then.
Okay.
Fantastic.
Good.
Cool. Excellent.
Thank you,
Thank you. You're a brother. Brother from a different mother. Yeah. We go back, 15 years or so?
Easy.
Yeah.
Yeah.
Yeah. It's been always a joy. Lance he's really like a brother. I mean, he's just such a great guy and phenomenal musician. If you ever get a chance to see Lance perform, it's quite a thrill. Just an excellent drummer. You've played with some of the greatest, right? Yeah. Diana Ross. Mm-hmm. Toured with the Temptations for many years, and he's played with Kenny G, of course. I love he's got online on his website, the Donny Osmond. And you'd think, oh, come on, Donny Osmond, but boy, you guys really rocked out in that one song. It's like phenomenal. So you've been around. He's great. Okay, so other questions?
Yes. So let's get started. So I'm going to kind of go in the order they came in.
Okay.
But let's get started with the ones that might need demonstration.
Okay. In case I gotta bring Lance back up.
So let's do the one you sent me earlier. How to avoid the possibility of influencing the test either by the practitioner or by his previous patient.
Okay. So here's a question that came up. How to not influence the test. And that's something we teach when we're talking about muscle testing to begin with, is you can influence the test with your mind. So first of all, when you're testing someone else, have a totally open mind and not an attitude like, oh, I know what it is, and I'm going to show that it is what I think it is. You always have to remain neutral and have an intention to get accurate results. Now, we do vials, we do this in our biochemical. I don't know what vial they're touching. They're like, I'll show you the test kit here. There's all these different factors like, electromagnetic frequencies like 5G, and we have toxins like, and microbes like E. coli and H. pylori. And, so I don't know what they're touching, and they touch a vial. I have them do 3 or 4 at a time. And so I don't know what they're touching. They don't know. And then I'll pull it out. So double blind tests are often good. But I also, if I need to, I can count to myself while I'm testing, or if the person, like say we're testing foods and he's thinking of a food that he wants to, oh, I love that food. I don't want to let go of it. And then he's strong because he's attached to it and he's not wanting to let go. So I can do it where I have a food kit too, where they don't know what they're touching, as well as I can have him count. If he's thinking, or if the person I'm testing is thinking about something like, oh, I want that to be strong, I say, well, just count 1, 2, 3. And it takes their mind off of it. And then I get more of an accurate result like that. Now, there was another question about, well, could you have things spill in from somebody else that goes into your testing? In other words, I work on Lance and the next person comes in. Now, I've balanced them first of all, but she was thinking, well, could you have something that you got off of Lance and then it's showing up in the next person? I don't find that happens, but one of the things I do is I wear these necklaces, and I'll show you here. There's some that have sacred geometry and scalar factors for energy and these crystals and all that. And okay, so if you're interested in getting these, I get this one from a guy in Sedona. I can just email me and I can get you access to that. And this other one comes from England, actually. And so I find when I wear these, my energy stays really clear. Now, also, you want to keep yourself balanced. So before I work with somebody, I balance myself, just like I was showing you guys. I do more balancing techniques. And then also, if you visualize yourself surrounded by white light, and at the end of a session, I'll wash my hands to clear off the energy from that person. You should always do that. So I find that I don't get energy spilling over. One last thing is if you're testing somebody and you're finding something goes out and the next person has the same thing, you might think, oh, is there something going on with me? Well, your own energy balances can spill into the person and show. So way you can take yourself out of the test is if you touch here and test, then it's taking you out of the test. So if you see a change, then they're weak and then they go strong, oh, it's me. So you might want to balance yourself. But again, I like to stay balanced as much as I can. And just realizing the overall formula here is living, eating, thinking. It's keeping a healthy lifestyle because it's our lifestyle basically that puts us out of balance in the first place. In terms of eating, I only eat organic foods and I test foods. We have a whole, in our Applied Kinesiology Fundamentals, we have a whole 4 hours of classes on doing self-testing and balancing. So I test all my foods. When I go shopping, I was at Trader Joe's last night and there were certain foods, oh, I love this food. And I go, oh man, I test weak on it. I do the sway test if you've seen that. And I go weak on it. So I'm not taking that because I'm committed to having my best health for my own self as well as others. So you eat foods that switch you on. You are around people that switch you on. You only watch media that switches you on because I don't have TV. I do not watch the news. I get feeds every now and then. It lets me know what's going on. But I keep myself focused. There's a new movie out. It's based on the teachings of Eckhart Tolle. I think it's Somebody's Secret. I just got it today in my feed, and you can watch it for free if you're interested. It's oh God, I can't remember the name. It's the guy's name's Secret. That's Kid, and it's starring. If you just Google it, it's starring Sutherland. What's his first name? The father of Kiefer. Donald Sutherland. Yeah, his new movie. And so watch uplifting stuff. Be around uplifting people. I love going to Tony Robbins events. Everyone just lifts you up. If you're familiar with, let me get the book here. I think I've got it. Yep. If you're familiar with Power versus Force, great book to get. This guy, in fact, Sheldon Deal, my mentor, is on the back of the book because he was Dr. Hawkins' professor in kinesiology, and he talks about states of consciousness. And when you get to higher levels of consciousness, which is really the name of the game, you are then at a state where you're not having people's energies spill into you. You can be a clear vessel for healing energy. So it's a whole formula for that. What you're thinking, what you're focusing on, and your lifestyle. Like I meditate every day. Do meditation every day. That's a lot of Eckhart Tolle, if you're familiar with his work. A New Earth is a great book, as well as The Power of Now. And when you allow yourself to go into a state of consciousness where you get out of your ego reactive mind into your higher receptive mind, you plug into universal intelligence and things flow. You resonate in ways that keep you in health. You make choices that are aligned with that higher state. So this is a lot of what we focus on in our classes. Okay, next question.
All right. So So this one might be a demonstration. Salmon asks, kindly show fixing feet or feet turning inwards.
Okay, Salman, we'll bring you back up here. I think he's asking, this is what we cover in our structural class, which he's done. Lie on your back like you were. And I don't know if we need a light for this, but I'm going to look at his legs here. Now, when you take the legs and you lift them up, and we cover this in our AK fundamentals class too, and you rotate them in. If one leg rotates in more than the other, especially if that leg is longer, it is a slight bit, that's an indication of a weak psoas. So again, the psoas is an external rotator. And if you grab the legs and rotate them in, and the leg on his left goes in more, we're going to bring this up now, and I'm going to push down and out like that. Okay, so hold this leg and ready, hold. And look, there it goes, sure enough. So that's a dead ringer for that muscle is going to be weak. So let's just switch it on. I'm going to go to the neurolymphatic points and rub those. Any tenderness on either of those?
Both.
Oh, both. Okay. These are related to the kidneys. Psoas is a very key muscle, especially for back pain, nagging low back pain, and also can be related to sleep disturbances too. If you had any issues with sleep, okay, well, that's good that Salman asked this. How you doing, Salman? It's so great. We've had some excellent conversations. You still in the Toronto area? And let's see what that does now. Okay, let's see if it switched it on. Hold as I push. Much better. So now let's see if they turn in evenly now. And bringing that up. Look, they're even. And the legs are balanced. So that's another one to remember. And make sure you're getting enough hydration. How's your coffee intake lately?
Not as much.
Okay. Well, after a glass of coffee, drink 2 glasses of water.
Okay.
And then working these points like before you go to bed, we can make a little video for you too before you leave. So you can, that's what I often do with clients. I'll get on their cell phones and they usually have the video function and camera. And then I'll explain everything we came up with so they have something they can look at when they go home. Okay, so any other demonstration questions while I got them up here?
That should be all I have. Also, someone says hi, and he's still in Brampton City, Toronto.
Brampton, yeah. Brampton, isn't that where the great one, Wayne Gretzky, I think is from? There's something else I read recently that Brampton was like to be known for. You probably would know. But yeah, I've taught in Brampton, actually. So it's great that you're there. All right, so good to hear from you. Any other demo questions?
One just came in, which is here, and I don't think so.
Okay, all right. So let's have you get up, and then in 5 minutes we'll do the drawing too to see someone.
We do have like 6 questions.
Okay, great. Well, I'll keep going. We're good to go.
All right. So hi. Can you tell me when and where is the next hands-on course for structural kinesiology?
Oh, great question. Email me your contact information, and we're setting up dates right now. We're looking at in Long Beach doing one, and we may do one in Florida. We're looking at Florida as well. But we have one in 2022. We're going to be doing one in Long Beach. It possibly will be like in May and July. But here's the deal. In all of our advanced courses, you enroll beforehand, and we give you 24 classes that can be anywhere from 45 minutes to an hour and a half long, where we're teaching one basic technique or certain set of muscles to give you a bite-sized piece of it. So again, if you go on kinesiologyinstitute.com, you'll see each of the structural, see, we got structure, nutrition, we call that biochemical. Again, that's the one that's coming up right now. Energy kinesiology and psychological kinesiology, which is phenomenal. So we're going to be having energy kinesiology coming up hands-on the beginning of next year. And then probably right after that, I'm guessing May and July, we'll have the hands-on in Long Beach. And we're looking to potentially schedule one in Florida. So get me your email information if you're interested in that, and I'll make sure that you're posted on that when we have it. So I also want to remind you, we have the opportunity for you to get the interview, or let's call it a inquiry session, where I can answer, or one of my staff can answer all your questions. So make sure you go on and set that up, because we're only available for the next few days, say until probably Tuesday of next week, that I can meet with you on that. So that's through, again, the link that's on the website, or I think you've got it in the chat there somewhere, and you can click on that link to set up an appointment. No, it's free, no obligation. Okay, so next question.
All right. What is your advice for those that live in states that are trying to pass bills that prevent non-licensed practitioners from touching clients, rather only allowing licensed practitioners to practice?
Okay. So the question is, what's your advice for people that live in states where they are passing bills that only licensed professionals can touch clients? Well, one of the things we teach in our programs is how you can do remote sessions where you can do testing on people. And I do this. I've had clients in Paris, in other countries. I've got a woman scheduling in Prague with me. I have Florida, clients around the country. And so you're not touching them, but you can test to see what's out on them and have them work on themselves. We teach you how to do those remote sessions. Also, some people have said, I know that they've become ordained as ministers, and there's a regulation in that. There's certain other factors that you're doing energy work, but there are times where, again, you can work remotely. I'd say that's probably your best bet for now, or you might look at where you want to live. And I know a lot of people are going to states where they say, that's where I want to be, just the whole vibe of the state and that. But, those are some ideas. Next question.
All right. Can you send me? Is it possible to send me a Touch for Health book to Morocco specifically, but also internationally?
Okay. The question is, can I send a Touch for Health book internationally? No, I'm not able to do that. We have these regulations that we can only send over 150 euros to a lot of different countries, and under that, the regulations are we're not allowed to without having the special number that we have too much red tape to go through, because we don't do that much shipping, especially those items. If you want the Touch for Health book, you can look on your online and see if there's a way to get that in your area. There's lots of translations to it, so I would suggest Googling and see where you can find, if you can find that. And if you wanted to order more products to go over $175, basically, we could probably ship it to you. As you go on kinesiologyinstitute.com, there's a products menu, and if you click on that, you'll see various products as well. Okay, next question.
All right. So Chantel asks, how long does each client session usually last?
How long does each client session usually last? Well, depending on the client and how much time and where I'm at, I would say generally I do an hour to 90 minutes. However, I've been in places where I would do very short sessions. I can get a lot done in a short period of time. Now, I was explaining things to you with Lance, but I could have done probably that whole session in 30 to 40 minutes. So I'd say from 30 minutes to 90 minutes. And sometimes if a person's in an acute state of pain or problem, it's better to do short sessions and do them more often. Like my chiropractor is an 8K practitioner. At times he'd have me come in the morning for a little session, and then in the afternoon come back for another one. So it's basically according to generally an hour, to answer your question, is what I generally do. Next question.
All right, next question. What do you do for Parkinson's disease?
Okay, so what do you do for Parkinson's disease? Applied Kinesiology Fundamentals, I believe it's, it's AK Shortcuts, Sheldon Deal's program. He has a protocol for that. And basically, Parkinson's is a deficiency of the neurotransmitter dopamine. So rather than I can't really say exactly what I would do, but this is true for any condition, is I see what's out on the person. I don't treat Parkinson's. I treat, or let's say balance more appropriately, the person, whatever's out on them. So I have made strides with people. In fact, one person that they were shaking at the end of the session, they weren't shaking anymore. So there's basically it's things we cover in my biochemical kinesiology course where we're looking at how to balance dopamine. And again, you're always looking at the whole person. So we want to treat something, but if you see, oh, someone has gut issues, and where's their priority? Sometimes it's cleaning and clearing toxins to start with, is drinking more water, um, shifting things in their diet, stopping the insult, because a lot of people are eating foods that are so toxic that you can't get anywhere. So you start with the basics, back to eating, living, and thinking. And those are a good start. But keeping in mind, you want to see what the priority is. And that's what we do. We show other points in our courses of how to find priority under energy, priority over energy, and you're always balancing energy. When energy's balanced, symptoms go away naturally. Okay, how many more questions do we have? And then we'll cover, we'll get you in.
3 more questions right now.
Then we'll get our drawing in, okay?
All right, I have a client coming. She is a singer and she lost her voice during lockdown. Any pointers?
Okay. Well, the question is a singer coming in and she lost her voice during lockdown. Well, again, when you learn the testing systems, I would find out, where are the imbalances? And there's these points we teach for you that have been in our fundamentals class and in our other advanced classes. I would find the under energy. Now, I don't know if you've been to our classes, but the fact is, sometimes there's a lot going on emotionally with people. So touching those frontal eminences lightly and having the person do slow, deep breathing. You can do this with me now. And then whatever thoughts come up that are related to the challenge, like whatever stressors, I have them visualize like out in front of them, like these thoughts are passing by like clouds in the sky. And it's while you're touching these points, and then you get in a state of pure awareness and just notice, witness, what were the thoughts? What were the emotions, the fear, the anxiety? Just observe it. And by touching here and observing those things, it takes it out of your reactive mind and allows it to clear energetically. So after all the things that and the physical sensation, feel what it's like, where you have tension in the say the throat, where you have tension anywhere in the body. So you're observing those things while you're touching these points lightly, or they can be touching their own, breathing slowly and deeply. So it comes down to, what did they see? What did they hear? What did they tell themselves? What were the emotions? What were the body sensations? And after you cover all those things, so then I say, okay, now let's install the blueprint of how you want to feel. So then I say, okay, now how do you want to feel? See yourself singing and performing and being just the way you want to, and have them feeling that in a positive sense as they're visualizing it, they're seeing it, they're thinking it. It creates a mental blueprint. And that alone of what, one thing you wanted as a tip would be what I would do, along with any other skills you have, to see where there's blockages and opening up the meridian flow. Sometimes it's chakras too, like the throat chakra, that affects your singing and expression. So we have in our energy kinesiology course, we show chakra balancing. So there's many different things you can balance. When a person comes up, you just fix what's there. You balance what's there. But that visualization technique's one I would recommend. Okay, another question?
Yes, so we have 3 more. Do you have a class for Touch for Health instructors?
Do I have a class for Touch for Health instructors? Well, I have had a lot of Touch for Health instructors in my programs, and I'd suggest maybe you schedule one of those free inquiry sessions, because I can go over that. It's a lot of what the person wants to do. It's not like, oh, for Touch for Health instructors, we have them do this. But I find that when they take our fundamentals class, the AK fundamentals, applied kinesiology fundamentals, they learn things like, oh, I didn't learn this in Touch for Health, or they see it from a different angle. Even when I would go as one of the top Touch for Health instructors in the country, I would go see John Thie teach really introductory classes. And he'd say, what are you doing here? You know all this stuff. And I said, yeah, but I see it at a different angle, a different way that it puts together, and a way I can teach that I didn't know before. So fundamentals would be a great start. But if you want, I can show you. Some people like going into the structural course from their Touch for Health background, because they then get so much more in-depth knowledge about the muscles and the structure, because we cover things like pelvic categories, TMJ, cranials, all these different joint factors. So a lot of stuff that's not Touch for Health. But then there's the biochemical class. I can go on and on. There's so many things biochemical, and people like that are in the Eden Energy Medicine find often, wow, the biochemical stuff really broadens their practice. So, and then the psychological, many factors that go way beyond what's covered in Touch for Health, and profound transformational things that happen from that. Okay, one or two more?
Two more.
Okay, two more, and then we're going to call it stop on the questions, and then we'll do our drawing.
All right. Can kinesiology help with matters like autism?
Can kinesiology help with matters like autism? Well, applied kinesiology can basically help anybody that has a nervous system. And I've worked with autistic clients and patients that a lot of it is, again, finding what's there. And I'll often use a surrogate like the mother or something. Heavy metals are often a factor. Doing brain integration, injury recall, diet, like getting them on a gluten-free diet is often a key factor. So yes, to answer your question, it's finding out, just like anyone else, what comes up and clearing it, as well as what are the things they're eating they need to eliminate from their diet, potential supplementation, and a lot of the energy corrections can be phenomenal. Last question?
What is the difference between the energy and psychological courses?
Great question. What is the difference between the energy kinesiology certification program and the psychological program? There's a lot of interface, because the psychological is, a lot of it is energy psychology. So we're working with meridian points, like you might be familiar with the emotional freedom technique. Well, that started really with Goodhart, who found that, oh, these beginning and end points on the face particularly have an effect on people, both physically and psychologically. It's later taught by one of my instructors, that then a guy named Gary, well, first it was Callahan studied, and then Gary Craig got it from him to develop emotional freedom technique. So there are things that are energy in the psychological, but we're doing it in the context of clearing a person with psychological issues. Now, there's also a lot of techniques that are not in the energy kinesiology that are drawn from other sources. Like there's about 21 different psychological clearing techniques we teach you in that course. We also teach you what to do when. We also do things to set up, like, what's your vision? What's your purpose? Really giving people a platform to develop a life of meaning and joy. And we show you all these things, like how we have the 4 factors that create upset, the 6 psychological human needs. When you get those 2 components, you have a life of fulfillment and free from upset. I used to be a walking upset machine, as many of my clients would say. God, I used to get in traffic and it would just go crazy. And now it just doesn't bother me. You know, I've heard some of my clients and students say that. So lots of how to be happy, fulfilled, and really build that mission statement and that purpose. Okay, so that's psychological. And then the energy class, we cover a lot of other things that affect the psychological, such as, you know, balancing the meridians, but also a lot of pain relief techniques, like clearing pain in an instant. I had a man that was like level 10 pain. He was in my class, and I said, okay, I'm going to show how to find the point, one point on your body we're going to tap. And within about a minute, he said pain was totally gone. So a lot of pain clearing techniques. We also cover the chakras. That can be profound. I've had in client work, sometimes if I just clear the chakras, the person says, wow, I feel totally different, totally transformed. So chakra is great in our energy class. We also cover the auric fields and how you can have a hole in your aura, how to patch those holes, or how that can affect pain in the body. I had a woman who had chronic hip pain. She was an elderly woman, I think somewhere in her 80s. And they were telling her, yeah, we need to do a hip replacement. Well, when I was muscle testing, it came up energy. And I said, oh, there's something in your field. So I cleared this. And even for me, it says, well, this is a little too way out. But see, we don't see the energy, but it's there. Well, most of us don't see it. So I cleared this energy field in her hip. And she says, wow, it felt like you just took a vacuum cleaner and pulled out the pain, and it never came back. So the energy course, it's really good to have everything if we do. Most students do all of our programs over time, because then you have all the pieces of the puzzle that can help people most profoundly. So remember, you can go on applied, or it's our kinesiologyinstitute.com, and you can actually watch videos, many of them the first classes of those programs. And we're going to now do a drawing for who gets $300 off any of our programs. Now, and we have one that's on sale, $200 off right now, remember. That's the Applied Kinesiology Fundamentals, and that's our prerequisite program. So if you haven't done any and you win the contest, you can get that for free. But normally that's $500. We're now at $297 through the weekend. So how many people do we have currently?
So currently we have 33 people.
Okay. So what I'm going to do is I'm going to do a muscle test on myself. I push on, this is another self-test you can do. I take my index finger and push on my middle finger. So when my finger goes down, that would be the number of what person we would want that's going to win. So somebody between 1 and 10, 10 and 20, 10 and 15, 16, 17, 16, 17. So number 17 on the board is who wins the $300 scholarship.
Give me 1 second.
And he's going to tell us who that is. And the winner is, drum roll, please. That's what we brought. Yeah, we brought Lance in for the drum roll. Next time, bring your drums so we can have a real drum.
All right, so it's Juanita Perkins.
Oh, Juanita. Great, Juanita. So for future study, you win $300 off. That's fantastic. So she's in our biochemical certification program. So thank you for joining us, Juanita, who I believe is a naturopathic doctor. And these skills are so great for any doctor. We've had chiropractors. I've had orthopedic surgeons. I've had psychiatrists, naturopathic doctors, as well as nurse practitioners, but also massage therapists, physical therapists, personal trainers, the acupuncturists. The list goes on and on. We also have people that don't have any background even in healthcare, and they find this gives them a lot of personal benefit, skills that they can benefit from, as well as developing a career in doing this work. So it's been a joy having you on. I hope you found this very helpful. Got a lot of information in there, hopefully some techniques you can use. And remember, we have the availability. If you want to set up an inquiry session in the next few days, that's available for you. And we also have the discounts that are going on right now on the Applied Kinesiology Fundamentals course. So until we meet again, keep yourself in great health and balance through your living, your eating, and thinking, focusing on high vibrational field of people, of focusing on your media and high vibrational frequency, and coming from a source of love with everything you do. Until then, thank you for making the Kinesiology Institute your best choice in health and wellness education.